Okay. Hi, everyone. It's 25 people here in the stream watching now. Shall we wait a couple of minutes to start? I guess yes. Just a minute, and we will start. How's the weather in Uruguay, Silvina? Okay. You're lucky. And here is autumn. the summer. Yeah. It's right now it's 10 Celsius above zero. So, and
how bad does it get in winter?
I suppose minus. It can be sometimes minus 20. Yeah, pretty cold. But recently the winter has become milder. Okay, so I think we shall start. So I'm glad to welcome everybody at our first live session, and today our special event will be accompanied by a special guest, great professional, just a beautiful lady from Uruguay, pediatric radiologist Silvina Zabala Travers. Hi, Silvina. We're so happy to have you here. So, and before we start, I have to say a couple of words about. Just a moment. Could you please confirm in the chat if everybody's. They cannot hear you, Silvina.
Okay. Do you hear me there? I have active my volume, or maybe I could just turn a little up. Just let me see.
Yeah, the chat is telling. Okay, just a moment. We will. Now it's okay. Yeah, everybody's telling it's okay.
Okay, great.
Perfect.
I don't know if you heard me, so welcome everybody. We are happy to see you here.
Yeah, everybody's happy. So can we start? Before we start the demonstration, I have to say a couple of words about the program we will use today for the demonstration. So Inobitec DICOM Viewer Pro is a multi-platform medical software designed for advanced medical diagnostics and image processing. And one of the greatest features in this software is the segmentation, which we are going to show today. There is a wide of different extended tools, and we will cover a little bit after Silvina demonstrates some segmentation tools for you. So the first stream will demonstrate the real case of maxillofacial bone and tumor segmentation and mesh expert with the help of Inobitec DICOM Viewer Pro. The main purpose of this stream is to show the capacity of the program for the beginners. Silvina, can I ask you to cover briefly your part of demonstration?
Yes, sure. So as Igor was saying, you don't need to know anything about segmentation. The idea of today's live demo is to show that it's very intuitive and easy. So what we are going to do is we are going to load the real case about a tumor in the mandible. I'm going to go very quickly over some 2D tools you have with this DICOM Viewer Pro, and then we are going to show you how to easily segment some bone, some of the functionalities of the software and the tumor, so you can create in some minutes very nice 3D model for surgical planning.
Great. And before we start, I shall tell that we will try to divide our stream into three parts. The first part will be Silvina's demo case. The second part will be questions and answers session with the audience. So we will try to answer the questions from the chat. During the third part, we will try to cover, and if we have some time left, we will try to cover some other tools which will not be mentioned by Silvina. Please do not hesitate to ask your questions during the demo session by Silvina. We will try to pick up the most interesting and relevant, and we will try to answer them during the demo session. So now I shall turn it over to Silvina and let her do the case demo.
Okay, let me share my screen. Okay, Igor, if you can confirm that you see my screen.
Yes.
Okay,
yes, we
perfect. Do. So let's start from the basics. When you double click on the DICOM Viewer Pro icon, this is the screen you're gonna get. So it's very easy to upload your images. Just go to this little folder here. I have on my desktop the patient I want to load. Remember that if you have more than one kind of image, like CT and MRI, if you have both of them in one folder, just by opening that folder, you will load every image that you have for that patient, okay? So here you see I have uploaded my patient. I see the series I have with this case here. And just by double clicking the series you want, you will see the 2D DICOM image view here. And as I was telling you, I am going to quickly review some of the tools which I think are very important, because even if you're going to segment and create a 3D structure, there are some nice things that we need to know with the 2D image viewer. Since there are some measures, it's better to do on the 2D images. Just Igor, if you can mute your microphone, maybe it's better so connection is not interrupted.
Okay. Sorry.
So it's fine. Here, as you can see, we have the viewer window. So if you want to see more than one series in your screen, you can just drag and the next will appear, okay? I'm gonna go here directly to the multiplanar reconstruction here. You see this little icon here up on your left. And if you click over there, you will see that your image now is visualized by planes. So very quickly, I will go over the panel over here so you know what you can do with this software. So first, remember that this just comes back to your initial settings, okay? This little icon here. You see that we can just focus on one area and automatically the other planes will go to this spot we want. And one of my favorite features about this software is that you can personalize your settings. So your mouse and your different buttons just do whatever you are most used to with your everyday work. So here I am using, I don't know if you see my screen, I'm using a wheel mouse, which I strongly recommend you when you are working with 3D images and segmentation, because you can, it's very easy to work with a mouse other than your board with the mouse, okay? So only by clicking over the icon with the mouse button that you want to set, it just will be set. Okay, so I like to set, for example, my wheel to the pan. I just clicked over the icon with my wheel, and now this button for me does the panning function. Also, for example, I'm gonna select this one to rotation because it's the one that it's better for me for 3D modeling. But you can also do it like, for example, for window leveling. And you see now I am just clicking my right button up and down, and I'm modifying the window level, okay? So this is a very nice feature. You have also all the visualizing and measure tools. So this, for example, makes a video of your DICOM series. And if you want to record this series, you have this button here. And if you want to measure, you have all these different measure tools here. You can just do simple measures like the ruler by clicking, or you can measure angles, which is very useful. And you see the angle just gets here. And if you're working, for example, with scoliosis cases, you have the cop angle here, which is very nice and easy. And particularly for segmentation, these two tools, or three, the point value and the ROIs, are very, very useful, because sometimes we need to know what Haunfield units we have on a specific structure that we want to segment. So by clicking, you have your Haunfield unit here, okay? And if you do the ROI, for example, let's say I want to segment my brain, so I can just select ROI like a square, and I have the minimum and maximum Haunfield units and the median, which is very useful then to set your threshold, okay, for segmentation. Okay, so you can just delete it by removing object. I just did a right click over the object I want to remove, or you can use this one that will remove every measure, okay? So this is just for 2D measuring. Remember that it's always best to measure things and to diagnose from 2D images, and to use the 3D images to just understand better the anatomy, but do measures preferably in the 2D because that's more precise. Okay, so next, I want to show you this icon here, which is volume reconstruction, or the 3D view. You see I clicked, and then all my volume is represented here in 3D. Okay, this is nice. You have all the components of our DICOM image here, and we will be working with that later. And I will go very fast to the segmentation panel. Okay, so from here, I will just click on this button here, on this icon, and our segmentation panel appeared over here on our right. So to start, you see we have our 3D model here on this window. We can rotate it. Okay, so I'm not rotating, I'm just moving my window level because I have set here my window level. I will set my button, my right button, to be rotation. My middle wheel will be panning, and then I will use the left button for whatever function I'm using at the moment. So now I can rotate my model here. And there's one easy thing we can do. We will not use the table for anything. So there's this icon here, which is table removal. You just click over it, and software will automatically remove the table, which is nice. Okay, so to go over segmentation, there are some few concepts that we need to learn or to review so you understand how this software works. First, base volume. Base volume is everything, every pixel we have in our DICOM image here. So it includes all pixels. I will just, using this eye here, I will remove all information from your patient here so we have more clean our screen. So here, base volume, every pixel, and you see you have the 3D view of every pixel in our DICOM image. So when we talk about segmentation, segmentation means labeling. what means? So segmenting or labeling is I'm gonna, from this entire DICOM image and all these pixels, I want to select just some of them and label them, for example, as bone. So every pixel that is bone, I want to segment and create a 3D image from that. So after so this is what we're gonna do now. Mask, which is the other concept that we need to learn, is from this base volume, what pixels we are gonna work with to create our 3D model. This is called a mask. In this example, we are gonna segment bone. So I want to work with every pixel that could be bone. So I will select here my threshold as 200. And remember that you want to select high intensity. So my mask will be every pixel that is above 200 Hanfield units. So you see something green appeared over all the pixels that are above 200 now. This is our mask. So I am telling the software what pixels I'm gonna work with to create my 3D model, okay? This is called mask, and you will see it here with the word segmentation, okay? This is segmentation mask. So now from this mask, I'm gonna create my 3D model, which is also called mesh, or you see surface here, create surface for current structure. So this is what we have. From this mask, we are gonna use this little tool here, which is segmentation from point by mask. Okay, I'm gonna select the tool with my right click. And now, if I click over my mask on a point, every pixel that is connected to that pixel will be selected to form or to be part of my 3D model. Okay, so you see that everything that was green, mask will always be displayed on green, is now yellow, which means that it's selected to be part as my 3D model. So here, as you see, I'm gonna zoom a little bit in. We have the hyoid bone, which is also bone, but was not connected to my pixel, and that's why it is still part of the mask, but it is not part of my 3D model. Now we have a third step. So from my mask, I already told the software what I want to be part of my 3D model. Now I want to create my 3D model. And then we have to click over this little icon here. Now I have created my mesh, and I will see my 3D model here. So why I see the same I was seeing, because you know, when we talked today about base volume, if we unclick, we don't see base volume anymore. We just see whatever 3D object we just created. And you see everything that was selected in yellow is now part of my 3D model. Easy, right? Now you have a 3D model of your skull. There's even an easier way to do this. So I'm gonna uncheck this. So we have our space clear. I'm gonna go back to my base volume here. You see everything that is part of our DICOM image. We see it in 3D. And there is this nice way of creating, for example, a bone 3D model. I'm gonna use the adjust window level tool here. So this is another very nice feature. We can select the window level, not only to change our gray levels here, but also on our 3D model. So now I'm just left clicking and scrolling down, and you see I'm just seeing bone. So going again, I was with my base volume, seeing everything that was part of my DICOM image, and I am using this little button here, adjust window level. I scroll down, and now I only see skull and bone parts. Okay, you can adjust it, go a little, even a little down. This means that I am only seeing the higher level pixels here, the higher unit Hounsfield pixels. So how do we create our model from this? Remember that we are on the base volume. This is not a mesh. We go over here. We copy whatever we selected from our base volume. And now it has become the mask with my selected area. We go to create mesh. And we have, again, the same model here. So remember, you can change here the colors for your model. I like to see them lighter. I think it's better for understanding of the structures. You see what I just did? We can maximize this window over here to see only the 3D view. If you like to see the DICOM images at the same time, you can just drag here. You can change the positions, or you can just drag and make this window bigger. We can rotate the model. And now we are gonna use some of the tools we see here. So for example, you see we have the highlight button here. Let's say I want to remove this. There are different ways of removing this part I don't want to. So we are gonna use for this the first four tools here. First one is polygon cut, which means I will select the area I want to cut. When you double click, it means you have selected everything you wanted. And now, remember, you have to uncheck the base volume here, otherwise you're seeing everything. You only want to see the segmentation you are working with at the point. You see, now we don't have that object anymore. If you did it wrong, remember, Control Z does the game, and now I have it again. You can also use this one, which is the inverse polygon cut, which means that we'll cut everything which is not what you have selected. You see, we have another color for this line, which means we are use the inverse polygon cut. And now everything that I selected is still part of my 3D model, and the other one was deleted. We have an easiest way to do this. I will do again Control Z. We have this tool, which means cut object. So I don't want to hide it anymore. I click over it and it disappears. Or we have the other option, which is cut all except object. I found this one the most useful. So I just click over whatever I want to get, and everything which is not that object will be deleted. And that cleans very easily your mesh. Okay, so this was, I think, the easiest way to make your 3D model. Remember, from base volume, you just need to use the window level, and that makes the trick. Okay, so now we're gonna try another thing. There's a very nice feature we can do here, and that's separating different bones using this tool here, which is Watershed segmentation. Okay, so what that does is that it separates, for example, two structures. Let's say I want to separate this vertebra from the other two, or from the rest of the model. So first, what we are going to do is I want to, you see here, everything seems to be connected, and that's because all the pixels that are in between these two structures are also high, and then the software considers it's all part of our bone. We can change that using our same adjust window level tool that we used before. So I clicked here, I drag down, and if you see, when I drag down, it reduces the number of pixels that I have selected as part of my bone. And then you can see it's like clearer, and you have like more precision on the joint area of the vertebra. This can be useful for different functions that you may need. So how do we separate the vertebra now? We are going to use two things from our panel. First, this little icon here, which is a marker. And then this other tool, which is Watershed segmentation. So now what we need to do is to create different masks for the different objects that we want to create. And this is very easy. I just want to duplicate whatever I have here. So you go to copy the segmented structure. Okay, I'm going to change color again. I'm going to make it lighter. Now we have two same things. You see, bones and two same things. I'm going to mark one vertebra, which I want to separate with one color. Remember that I'm standing over, let's say, our vertebra, which will be isolated, will be the light blue one. And all the other structures will be with this color. So I step over the other object and I will mark with the color the other vertebra. Now you go over this little icon here. You can just do some little more marking to make sure it will work. And we click over this icon, just say OK here. We wait a little bit and you see, works perfect.
Silvina, sorry to interrupt you. Don't forget that you can rename the segmented structures for visual comfortability.
I will. So now we have this separate vertebra. So we can change name here and put vertebrae. Okay. Now it's set name like that. And here we have all the skull. Now, if I uncheck, I will just see the vertebra that I just segmented separately. This is easy, right? So let's say you have this little hole here you want to remove. Remember that we can always go to the window level tool. And if you drag up, now we can increase the pixels for this little part that we segmented, and it will only work with this without changing the other part of our segmentation. I hope that's clear. Okay, so this was for segmenting. We learned so far to get the bones from our DICOM image. We learned different ways of cutting parts of our 3D model that we do not need. And now we are going to segment the tumor so you can see another way of segmentation. Okay, I'm going to start all over again. Remember, we can just remove here the markers. We are not going to use them anymore. So I right click over the pointer, the marker, and I can just go here and remove all markers. It will remove all from the same color, okay? And I remove these two. And now I have cleaned my view. Okay. Now I need my 2D view to segment the tumor. So I'll just make it a little bigger. I want to start all over, so I can just use here reset views orientation. Okay. I'm going to go to my tumor. And I'm going to increase here and I zoom a little in, pan to get my tumor on my field of view. And since you see here the window level is not the best to see what the limits of my tumor are. Remember that you have to be selecting base volume here in order to change window level from all pixels. We are not working on segmented structures, just all pixels of our volume. And now I'm going to select this tool, and I'm going to remove here to adjust window level so I can see better my lesion. Okay, that's much better. Now I can see limits of my lesion. And this is very important because sometimes with these patients, what we do after 3D modeling is to create surgical tools, surgical guides that will tell the surgeon where to cut in order to remove the lesion with safe margins. So it is very, very important that this part of the segmentation is at least reviewed by a radiologist, since you will be telling the surgeon where your lesion ends, and you don't want to make that wrong, since that would lead to errors on the surgery, and could make the patients to have tumor left, even though you surgically and virtually planned everything. But you want to make sure that this step of your segmentation is really precise, okay? So here we are going to use another way of segmenting, okay? So in this, we are going to use one of the tools we were talking earlier about. I want to know around which Hounsfield unit values I have here. So I will choose ROI ellipse. I will select some part representative of the pixel values in my lesion. And you see I have some that are very high and others that are around 200. So I will use this information to now create my threshold. Okay, we'll remove that. We are going to create a new mask. So I'm going to be telling the software what pixels I want to work with. And we are going to use this interval now. So I want all the pixels that are above, let's say 180, and that are below 800. So you see I have covered most of my lesion, although there are parts that I don't want that are still part of my mask. I will try to adjust that. You see I came here to my segmented structure. I will be modifying the mask now. And I can select here, what I did was to activate this little tool here. I will select 210 and check how it looks like. Oops. I have still the tool remote. Click over it and it disappears. And we can always use this tool as we were using earlier. So you see, I can just make it appear or disappear, or make it bigger, or select more part of my model. Okay, I think I will work with this window. So now what we are going to do is we are going to work with another tool. Wait, I'll just put it a little lower because I want this part of the model to be included. Okay, so now I have most of it included, and we can work with that later anyways. So now we are going to use this other tool, which is region growing, okay? So this tool allows me to click over a part of my mask, and just dragging it down, it will color everything that I want to be part of my model. So you have to check that everything you want to be included on this 3D model of the lesion is included. Pay special attention that limits of the lesion are all included. You don't want to leave out anything of your lesion, because that means you won't consider that later for virtual surgical planning. And you just scroll up and down and make sure you paint it over everything that was part of your lesion, okay? Okay, I'm pretty happy with that. And you see here, I have a little demonstration, although I have not created my 3D model yet. I am seeing live whatever I am selecting here to be part of my 3D model. When I am happy with that, remember, just go here and create your 3D model. And then the word mesh will appear here, which means that you now have your 3D model of the lesion, okay? So if we make it a skull appear, now we have both things. We have the skull and we have the lesion. We can make the skull a little more transparent so we see the lesion where it gets. There is also a very nice tool here that it's called the clipping box, which allows you to reduce the field and to show different inside objects. You see, if I move this, now we have a different view. And we can see the 3D model of the bone with the lesion inside. Okay, so work is done. You have your skull, you have your lesion, and now we are gonna save that. We want to export our mesh. Okay, we're gonna export our mesh from the skull and then the mesh of the lesion. Remember, there are two different objects that you want to export. So I will be standing over skull. You see here, you have this little icon which says export mesh. I'm gonna click over this and I'm gonna use my desktop just to save as skull. You have different formats here. You can export as STL, as point opt, or as PLY. You can just select whatever suits you best. And you click save. And then it appears on my desktop. And we will do the same thing with the lesion. We just step over the segmented structure. We go to export mesh, and we will name this tumor. I will select also STL, because then I can upload that in a different navigation software and just work with that further. Okay. There's also very nice other thing. Let's say I will delete here the object of the, let's do that with the vertebra. Just step over here. I will delete vertebra. You can delete from here. You delete the segmented structure. And now let's say I already worked with the vertebra in another software and I want to re-upload the surface. That means import the surface. We can go to vertebra and then just open vertebra. And now I can see the vertebra that I just deleted. And this is very nice because it's very useful when you work, for example, creating surgical guides for this patient. You can work in whatever software you use for your virtual surgical planning. And then the last step, I would recommend it to be checking, double checking that whatever you planned, let's change this color. Whatever you planned goes exactly with the model you first created, so that you know it's precise. Let's say I created a guide for this mandible thing. So I would be importing this object and my guide would be appearing right here or here, okay? So I think with this, we just covered the most useful tools just for beginners. I hope you followed all the process, and I'm happy to answer any question that you might have. So Igor,
thanks a lot, Silvina. That was perfect. I would say for the beginners, I would say even more. I hope there will be some questions in the chat because I haven't seen any during your performed your demonstration. I guess it was so captivating and fascinating that they were tracing you all the
Everybody
time.
was concentrated.
Yeah, and they were just afraid to miss a thing because there were so much functions were covered by you and they work pretty quickly, don't they?
Exactly. They are very, very easy to use. So another thing that it's also very nice about this software is the people that is behind this software, which I found was the most useful thing because they taught me how to do this, how to just use all the tools we normally use with any other software and how to translate it here. They're mostly the same. I found it that with this software, it's a little bit more intuitive and fast to create the same models. And they really listen to you. They are there to help you on your first steps. And also, every time I go over something and I say, oh, this could use some, I don't know, adjustment, or I would like this to be in this other way, you can just tell them, and it's very nice that the software is updated and they just include everything that is useful and could make the software better. So I think that's a very nice thing that has all these people behind the software. Software is alive and it's changing with you and with your needs.
Thanks a lot for your comments. Celine, can you get back to the screen so everybody can see us?
Sure.
We have a couple of questions from the chat. I can the one guy is interested. Do you use 3D printing in your practice?
Yes.
Can you?
So 3D printing, it's very useful for some specific things. So what I've seen in my practice is that most cases just benefit from the model, like the virtual model that what we are doing now. So you can do the planning by learning a lot about anatomy and learning how the tumor is related and if it is close to a vessel or a nerve. And we use 3D printing mostly when we do the virtual surgical planning. We create guides, surgical guides to remove the tumor with safe margins. And when we do that, we print the guide, obviously. The guide is printed mostly in resin, and then it's sterilized to get to the OR. And together with that, we print the plastic model in PLA, so the surgeon is able to practice the procedure. And everything like the STL I just exported from this software is mostly ready to be printed. You just have to upload it to whatever software you use to prepare your 3D prints and just print it. So hope that answered your question.
Yeah, I guess it was a great answer. Another question is by Alex Johnson. Hello, is it possible to save the segmentation to a file?
Yes. So thank you for
yeah, we
that
have.
because I can tell you where we can do that here. Let me share a little my screen again. So you see there is this icon here with the saving icon. You can save your project by clicking here, save project, okay? So project will be saved, let's say we go to our desktop and we will save it with this name. And once I click save, I will get this specific file. Let me just see if I can share with you my screen so you see the file. Okay. Now you see how I see the file is a .spj. So Next time, you just open your viewer, you upload your data, and when you get here to the MPR reconstruction, you just go here again. Let me go back to the screen. So next time, we'll just do this. Let me show you. So I already saved that. I have data in my folder. Double click here, since we did today, as we did today. Go to MPR, and let's go to the segmentation panel. And now it's already saved here because I didn't close my window for the software. But if you go to Open Project here, you will see that I have now available my SVJ file. So if you double click there, you see it's a very big file. So you have your images, and also you have your segmented structures on the mesh there. It's very easy and very safe to have it too, because you never know what can happen. You want to save all your work.
Yeah, in the future versions of the program, we will add the auto-saving mode, so it will be saved any preset period of time. So yeah, another question by Mikhail. I guess he's from Russia. Do you use 3D printed aorta model for making stent graft fenestration?
I didn't get that question. Can you do that again?
Do you use 3D printed aorta model for making stent graft fenestration?
Okay. Yes, I've done that. We used it for a couple of patients in vascular image. So they work very well. You need an angio CT, then you get the 3D model, which is very easy, like we did for our skull. And yes, mostly what they do is like we just print the aorta, like half the aorta, with all the spots where it's supposed to be fenestrated. And they use it to pre-plan all the graft, and surgery is easier and it's a lot faster with that model. So it worked very well. We printed it PLA, so it was very nice too.
Thanks. I guess there will be another one by Med 3D Print, the guy from Uzbekistan here. Do you use MRI data without contrast for segmentation brain vessels?
So remember that when you use MRI for segmentation, you need to have it acquired in a volumetric format. So mostly, if you not use contrast agent, you normally use TOF, and that it depends on what your center use. Here we can do 3D models out of that kind of images, and you don't need the contrast agent. You just need that whatever series you have and you want to get your 3D model from, it has to be acquired volumetrically, and then you can just use any image for any segmentation. And also you can use information from more than one kind of image. This software, which is a feature I also love from it, allows you to fuse CT information with MRI information, and then you get very precise models, which allow you to have the best information from the CT and also the precise, sometimes information from the soft tissues that you only get from MRI. And it's very easy. We probably cover it in the future in another tutorial, so you can look at that, because it's very, very nice, and also fastly you can get very precise and nice 3D models.
Okay, and I hope Med 3D Print guy from Uzbekistan will be satisfied by your answer, by your very, very prompt answer. And another question, is it possible to switch between surface and volume rendering on segmented parts?
I'm not sure what that means in terms of, because you have when we talk about surface, it's the mesh that we were talking about, like our third step. Remember that you have all the volume from your CT data as base volume, which was the 3D model that we were seeing at the beginning. The 3D view, it's not a model, it's just a 3D view of every structure that forms that it's part of the CT. So you were seeing like muscles and like soft tissue. But then we go to the mask, and from the mask we create a mesh, and that mesh is a surface. So you are talking about a very different object there. So it's a surface, just the pixels that you labeled to be part of a specific object, let's say the skull. So you created a new image. You're not on the base volume anymore. You copied some part of it and labeled to be part of a 3D object that you created. I don't know if that's clear enough. Maybe I didn't just got the question, or
right. I guess that was just about asking of checking or unchecking those boxes where you can make visible the volume rendering and the mesh. So at the same time.
Oh, okay, we can try that. Let me.
Yeah, you can just
there
show that.
To see. Yes.
But it's
so
available.
Remember to activate here the 3D view with this little icon. So here we have again our 3D view of all the pixels that we have on our CT image. I'm going to remove the table here. And let's say we want to look at the tumor. So I'm going to only left checked whatever I want to see, which is base volume and the segmented structure. And I'm going to make this window a little bigger. Oops. Remember that if we are over base volume, we can just adjust whatever we are seeing here. And then you see that we have our segmented structure here. You see we have, this is part of our base volume. And this is the object for the tumor that we just created. And remember, you can always use the clipping box. So let's do this again. Go up. Scrolling up, I get all the information from that CT. I will use the clipping box here, and I can just do like this. And so we have every structure from the base volume. That's to say all the information we have on the CT, and our object here for the tumor in a different color.
Great.
Okay, I hope that was what he wanted to know.
Another question from Paul Ozga from Poland. He's wondering, are there designated people in your hospital who only deal with segmentation?
Okay, so in my hospital, I work for children's hospital here, a reference hospital. We have an area, an innovation area with radiologists, which is part of our radiology department. And we are a team. So this is more than ever a multidisciplinary task. You want everybody to take part of this process. For on the one side, you want the surgeon that will be working with your patient to tell you what he needs to see. He needs to see the tumor and the relations with the bone and the relations with this or that vessel, depending on what procedure he's going to have for that patient. So after that, you need your radiologist to check that image and to work very close to the engineers, which may help you. In our case, we are a very low resource hospital, so mostly us do everything as radiologists, and sometimes we get the help of an engineer for complex stuff or just to help us. And we work together on the segmentation part. But remember what I told you, when it gets to segmenting the tumor or very sensitive areas that will change whatever is the treatment for your patient, you need to work with a radiologist to help you decide the limits. And after that is done, we also make the printing. So we do everything as radiologists there, but that's how our laboratory works. it's best if you have an engineer to help you with the process of 3D printing as well. So remember, this is group and this is multidisciplinary task. You want everybody's help. Clinicians know what they need from you as image, and radiologists will help you to understand the image, so help you as an engineer to know what to be part of the 3D model and to make it to make the tool work in the most useful way. So it's a little bit of everybody. So to get a precise model and to make the virtual surgical planning a success.
Yeah, because we're talking about the human's life, and it's the most precious thing.
Exactly.
It's backed up by a great team of professionals there in Uruguay, in your children's hospital. Okay, let me see the chat. Do we have any other questions? Banu from Turkey, thanks for those wonderful and detailed explanations. Thank you for coming, Banu. Great technology. Thank you, Fabio. So segmentation, Paul is still asking. So segmentation process working in program is made by radiologist, right?
Here, yes. We, as I was telling you, have sometimes the help of an engineer, but in our hospital, as I was telling you, it's a very low income hospital, so has like state hospital. So we don't have much money to hire as many people as we would like to. But I think that with this kind of software, you can just teach radiologists how to get from DICOM images to 3D models very fast. If you have an engineer, that's great for you, and it's probably the best part to work in teams. But if you don't, and if you only have radiologists, and if you want to make this new kind of medical images, remember these are medical images. It's information that comes from a CT, which is information from a patient, and you're going to use the image, the 3D image you are creating, you are going to use it for diagnosing and for treatment. So this is part of the definition of a medical image. So who best than radiologists to be part of the process? And what I cannot imagine a better task that we can make as a team. So making clinicians and radiologists and engineers to work as a group and create these amazing tools and for the patient treatment, which is what we want in the end.
Thank you. And another question by Mr. Hernandez. Where is the bottleneck, in your opinion, to make 3D printing common in any hospital? What is the bottleneck?
Okay, so for that, I would like to say one thing, which is don't wait to have a 3D printer to start using this technology. Because as I was telling you, in our hospital, most patients don't get to 3D printing. We just stop at the part where we have the 3D model, the virtual 3D model, because that is enough sometimes to plan a very complex surgery. Okay, so that's the first part. Everybody should start using this technology because it helps a lot. And sometimes you don't even need the 3D printer. So for those patients that need 3D printing, now I think hardware in terms of a 3D printing is every day more affordable for the different hospitals. So I think the bottleneck sometimes is getting people trained to create the 3D models and to print the 3D models. This could be easily overcome because, as you're seeing now, I am working with a patient remotely. So you can get people to work on this, even if you don't have on your hospital dedicated professionals. You can always ask somebody else from other hospital to help you, or some consultancy to help you with this process, okay? And you can also ship whatever you need as 3D printed from other hospitals. So there's no need to have inside on your hospital a 3D printer or human resources that are prepared for that, because this can be done remotely. So even if that's a bottleneck, because some hospitals think they need to have prepared human resources or hardware on site, it's easy to overcome because we can work remotely and we can ship whatever people need and surgeons need to prepare the surgery. That's a very nice thing in the world we live. That is, globalization is great, so we can get things or image like this. It's just one click away, and things like the 3D printed model is just a few days away from whatever part in the world you are. So there's no excuse. That's what I would say. There's no bottleneck. We just need to start using. Most of it is education. So if our own colleagues, surgeons or radiologists or people at the hospital that makes the big decisions know that this is available and they can use it, I think that's the biggest bottleneck.
Okay, thank you. We've got the question from Banu. As a coordinated team, you have gained experience for many different types of cases. Cranial, vascular, in which types of planning did you see the benefit of such featured software the most?
The software is great for every kind of image. It's not specialized on any area in particular, because you can create 3D models from CT, MRI, even you can get information from PET or from any volumetric image that you acquired. So there's no limitation on areas. If you're asking me which area is the one I work the most, so that's probably cases where they need surgical guides. So ortho, traumatology, oncology, maxillofacial, those areas you see we very fast created the mandible model, the tumor model, and after that, with a few hours work, you can have surgical guides and you can help a lot that patient. So I don't know if that was exactly the question, but software is not limited to any area in particular. It's great for any specialty. And my experience has been most benefits are for virtual surgical planning, where oncology, or also I work a lot on custom implants with titanium and implants. So in that area, I think also all specialties that work with bones and bone implants in particular, is this technology is great, is what you need.
Great. And I guess the last one will be, yeah, we have questions about the certification. I will answer them at the end. And the last question from the Powell, I guess. Besides 3D printing, what is most often technology used to present segmentation results? VR, AR, visualization on PC, or whatever?
So here in Uruguay, VR and AR are not as extended as I would love to. It's mostly not used.
Have you tried
So
this?
for us,
have you tried to use this technology yourself? I mean,
yes. We have tried it, and we bought some glasses and all the equipment. It's just not very extended, the use. And it also means that you have to get the equipment to the surgeon. Whereas if we use other sources, like, for example, send them the 3D model and ask them to upload them in a 3D navigation software, which are many which are free to use, to download from the internet. They can just navigate 3D models on their computer. Or we also, what we do is, when we know there's not much time, which we prepare ourselves videos where we show, like I was showing you the 3D view here, where we show the surgeon what they need to know, like the relation with the tumor, with this vessel or that bone or this structure, and we just make videos, which we then send them in MP4 format, so they can look at the model and even have it available on the surgical room on a screen with the information like focus. Whatever they need, the video is focused to show them like the critical parts of that surgery.
So you can also use our program not only for the segmentation, for the key purpose. You can also use it as the means of communication with the surgeon, and we have the functionality to record the video from the screen of the program, so you can record it directly from the program and send it to the surgeon. Yeah.
This little button here, you have it. Yes, you can record whatever you need to show them and then send them to easy checking.
Okay, so do you use virtual reality? You've answered that. So I guess I will sum it up for the audience about the certification and the use of the program. So what about the certificates? Right now we are on the brink of receiving our CE mark. We hope that it will happen beginning of next year. Because all the papers are ready. The next step will be FDA certification. So we are trying to to follow the rules, and first we received the certificate in Russia, our homeland for business, and then if we go forward abroad, we of course we receive CE mark and FDA where it is required, because again we're dealing with the health of people, with their lives, and we have to follow all the rules. Yes, and another thing that I shall mention, that the program is multi-platform, so it supports, it can be run on Windows, on iOS, on macOS, and Linux, of course. Another thing which can be probably interesting for the audience, that right now we're looking for representatives and dealers in different countries across the globe, which can sell our equipment to the hospitals. And at the same time, we receive the certificates to be fully legal everywhere. Okay, Silvina, do you think we can show something to the audience which can be interesting for them apart from you has just shown us?
Let me see. So probably the bone removal function. I didn't show it, but if you want to show it, I think that would be very useful.
Okay. I would say that should be interesting for everybody, because some automatic functions, they always look fancy. Okay, let's share our screen with the program, and we will be ready to show you the bone removal tool. Actually, we have two ways to remove bones: to segment vessels, or to analyze vessels or soft tissues.
I mean, this is just very interesting when you have contrast agent CT.
Yeah.
You see, you have a contrast enhanced, and you have the unit Home fields are similar for bone and for vessels. So that's very nice feature that can help you very easily to remove bone, so you only get vessels. That's what.
That's how it works. So the first tool is we will see on this coronary case. The first tool is remove bones. So we.
Are you sharing the screen, because I don't see your screen?
Yes, we are sharing it to the YouTube. I'm not sure we're sharing it to you. Just a moment, please.
Okay, don't worry. It's fine.
Oh, okay.
Okay.
So, it works quite simple. So you select the Remove Bones tool, and you just put the markers. First marker you put on the structure, pressing Control. Don't forget to press Control button. You press on the structure which you need to be left on the screen, and then you just click without control on the surface which you don't need. Now we click on the bones and we can see that they have been removed. Okay. As well you can remove some other parts which you don't need, it works like it removes all those parts which are not connected with the marked one. Do you see the result?
Yes, very nice.
Good. And another way, which is pretty automatic as well, is the bone subtraction, which is available in vessels analysis module, which is the part of this module. And it works like that. You activate the module and you combine the enhanced and non-enhanced series of the study, and just press OK. And if you can see on the 3D model, it removes the bones automatically. It takes some time, but works pretty automatic. As you can see below, all the bones on the fused images were removed, and you can see only the vessels here. You can clean
nice.
you can clean this again by the polygon cut tool, just to make the visual picture clearer for the diagnosis, and it works like that. Okay, so I guess another thing which can be pretty interesting, because sometimes bioengineers, doctors, and other medical 3D reconstruction professionals, they face the challenge to segment a certain structure with the boundaries which are very difficult to see on the 2D image or MPR, or where automatic segmentation tools, they just do not work properly for some reason. So we're gonna show you our newborn feature, which will be released and in version 2.6, which is called segmentation by contouring, the contouring tool. And I guess it will be very helpful for those professionals. So you just select the proper orientation, and yeah, just a second. Okay, we try to use the case to segment the myocardium of the left ventricle here, and we draw. We open the segmented panel because this tool is available on the segmentation panel here in our software, and yeah, we create the new structure, and we set the threshold -100, and select the contour segmentation tool. Then we start to draw the lines, the contours, inner and outer, of the myocardium, and we do it on a slice. This was the outer contour. Now we have the inner contour, and at the same time you can trace what has happened on the 3D view window. Then you just move the slices randomly, I would say. I'm just at the random distance, as you can see on the image. It doesn't. It's no need to make the segmentation. I mean the contouring on every slice. You just move it a little and everything, all the rest is interpolated by the program. As you can see on the top images, the axial and coronal plane, that the contours which are created manually, they have the blue color, or sorry, brown color, and all the rest which were interpolated by the program, it is highlighted with yellow. And as you can see right now on the sagittal plane, if you put your cursor on this surface here, it highlights automatically the contour, so it suggests you to contour automatically. You can select it, then you can, if you're not satisfied with the result, you can fix it manually.
This is very nice. I can't wait for you to release this.
Yeah, and if you switch the mesh and you make it visible, you can see what you're getting here. So it works pretty good as well. I think it can be a great help for you.
Yes, this is special for sometimes you get to segment structures that don't have a lot of contrast between each other. So for example, here the inner circumference does have some contrast between the contrast agent and the muscle. But then if you see the difference between the left and the right ventricle, it's not very easy to differentiate. And that makes it harder to segment by threshold, as we were doing earlier with the skull. So these kind of tools are perfect when you can visually see the difference between one structure and the other, but threshold doesn't work very well. So contouring is perfect.
Thanks a lot. So yeah, all the time we try to make the new tools, and we try to improve the existing tools based on the reviews, based on the feedback of the professionals like you, like other doctors which we are working with, and that is why we'll try to present the tools which is more comfortable and the most effective and the most automatic. I hope that will help.
Faith.
Yeah, finally it will help to save somebody's life.
Yes, you are helping already.
Okay, so I think that will be that was a great demonstration case with you, and you were a great help, and you gave so much information to the audience today. I just would like to send you many thanks to Uruguay, to you.
It was my pleasure, and I hope everybody enjoyed it and learned a little bit. I hope beginners feel confident to start segmenting. You see, it is not difficult. It's easy. My learning curve was pretty fast. So just try it, get in contact with these guys, which are wonderful, and they are of a lot of help, and just make use of these amazing tools to save lives.
Thanks a lot for everybody for coming. I think that was the first stream. It wasn't so bad. And if we have a good feedback from you, we will for sure continue working together with Silvina, and we will try to welcome some other guests to be the speakers at our regular streams. And thanks everybody, and have a nice rest of the day. Thank you very much for watching.
Thank you, everybody. Goodbye.
Goodbye.
Till the next
Goodbye.
time.